Depression and mood disorders affect millions of people worldwide, yet the stigma surrounding mental health often prevents individuals from seeking the help they need. Whether you're struggling with a persistent case of sadness or experiencing rapid mood swings, it's important to understand that you're not alone. Hello viewers, and welcome to Understanding Depression and Mood Disorders. In this video, we will uncover the truth behind these often misunderstood conditions, offering valuable information and support to those who may be struggling. So, let's dive into the video. What is depression? Depression is a mental health disorder that affects one's mood, thoughts, and behaviors. It goes beyond feeling sad or blue for a brief period of time and can impact an individual's ability to function in their daily life. Depression can affect anyone at any age, regardless of gender, race, or socioeconomic status. There are several different types of depression, including major depressive disorder, persistent depressive disorder, postpartum depression, and seasonal affective disorder. Each type presents with its own set of symptoms that vary in severity. Some common symptoms include feelings of hopelessness or despair, loss of interest in activities once enjoyed, changes in appetite and sleep patterns, difficulty concentrating and making decisions, fatigue, and lack of energy. It's important to note that not everyone experiences every symptom or the same level of intensity. What are mood disorders? Mood disorders are a group of mental health conditions that affect an individual's emotional state. Unlike normal fluctuations in mood, these disorders cause extreme and persistent changes in one's emotions, making it difficult to function normally on a day-to-day basis. The most common types of mood disorders include major depressive disorder, bipolar disorder, and persistent depressive disorder. MDD is characterized by feelings of sadness, hopelessness, and loss of interest in activities once enjoyed. Conversely, manic episodes followed by periods of depression define bipolar disorder, while PDD involves long-term symptoms similar to those experienced with MDD. There isn't any definite known cause for mood disorders, but several factors can contribute, such as genetics or family history, life experiences like trauma or abuse, substance use, and even certain medical conditions. Types of depression and mood disorders. Depression and mood disorders are complex and varied mental health conditions that can impact people in different ways. There are several types of depression, including major depressive disorder, persistent depressive disorder, bipolar disorder, postpartum depression, and seasonal affective disorder. Major depressive disorder is characterized by symptoms such as sadness or loss of interest in activities once enjoyed for at least 2 weeks. Persistent depressive disorder involves a chronic depressed mood that lasts for at least 2 years. Bipolar disorder causes extreme shifts in mood between manic highs and depressive lows. Postpartum depression occurs after childbirth, while seasonal affective disorder is triggered by changes in the season. Mood disorders encompass not only depression but also other emotional disturbances such as anxiety disorders, borderline personality disorder, and obsessive-compulsive disorders. These conditions often involve intense feelings of fear or panic along with physical symptoms like sweating or rapid heartbeat. It's essential to understand these various types of depression and mood disorders because each one requires its own specific treatment plan tailored to the individual's needs. Identifying the right diagnosis can help ensure successful management of these conditions over time through therapy, medication, or a combination thereof. Causes and risk factors. Depression and mood disorders can be caused by a variety of factors. Some people may have a genetic predisposition to these conditions, while others may develop them as a result of environmental or lifestyle factors. One major risk factor for depression and mood disorders is stress. When individuals experience chronic stress, such as from work or personal problems, it can take a toll on their mental health and lead to the development of these conditions. Another potential cause of depression and mood disorders is trauma. Individuals who have experienced traumatic events in their lives are at an increased risk for developing these conditions, particularly if they do not receive proper treatment or support. Substance abuse can also contribute to the development of depression and mood disorders. Using drugs or alcohol excessively can alter brain chemistry over time, leading to imbalances that increase the likelihood of experiencing these conditions. Some medical conditions may also increase one's risk for developing depression and mood disorders. For example, individuals with chronic pain or hormonal imbalances may be more likely to experience symptoms associated with these conditions. There are many different causes and risk factors that can contribute to the development of depression and mood disorders. It is important for individuals who are experiencing symptoms associated with these conditions to seek professional help in order to identify underlying issues and receive appropriate treatment. Symptoms of depression and mood disorders. Depression and mood disorders can manifest in a variety of ways, impacting the way we think, feel, and behave. Some common symptoms of depression include feelings of sadness or hopelessness that persist for weeks or longer, loss of interest in activities once enjoyed, changes in appetite and sleep patterns, low energy levels, and fatigue, difficulty concentrating or making decisions. Individuals with mood disorders may also experience manic episodes marked by high energy levels, impulsivity, grandiosity, or delusions. Other symptoms may include an intense anxiety or panic attacks, rapid cycling between moods, irritability, anger outbursts, self-harm behaviors like cutting or burning oneself. It's important to remember that everyone experiences these conditions differently. Symptoms can vary from person to person depending on their age, gender identity, and cultural background. It's crucial to seek professional help if you're experiencing any persistent negative symptoms affecting your daily life. Treatment and support options. There are several treatment and support options available for those who suffer from depression and mood disorders. The most common treatment option is psychotherapy, which involves talking to a trained mental health professional about your thoughts, feelings, and behaviors. This type of therapy can be done one-on-one or in a group setting. Another effective treatment option is medication, such as antidepressants or antipsychotics. These medications work by balancing the chemicals in your brain that affect your mood and emotions. It's important to note that medication should always be prescribed by a doctor and closely monitored. So, this was our today's video. I hope you all like this video. Don't forget to hit the like button and subscribe my channel. And also share it with your friends and family. We will be back soon with a new video. Till then, keep supporting and take care.